we intend to look at today is how do you recognize that dental diseases is setting in and you need to take action. Number one, we can do self-examination. Self-examination with our oral environment is very simple. You can stand in front of a mirror, and when you stand in front of a mirror and you open your mouth as wide as possible, look into the mirror. If you see anything other than the white color of the teeth, then definitely something is happening for which you need to have a look with the healthcare personnel, especially the dentist. Whether it is a change of color of the teeth, when we eat certain things, it changes the color of the teeth. But also, after our food, always there are certain remain of the food that settles around the teeth and over time become what change the color of our teeth and need to be taken care of in the clinic. This process that we call a scale and polish, we are surprised in the clinic when most of the people come and they tell us that they don't know about this process. It is the basic, fundamental preventive dental care that everybody and everyone that eats should do at regular interval. Number two, just like I said, dental checkup. That is, even if when you don't have pain, when you don't have any issue or problem, it's very mandatory for every adult to have a dental checkup at regular interval. Some could be as early as 3-month interval, some could be 6-month interval, depending on how we see our teeth when we look into the mirror. People who take a lot of coffee or tea or some of these cereals and chocolate, when they look into the mirror, often they will see that they are forming some kind of black stain around the teeth. And whenever these stains are there, definitely it's unsightly. Other people look at it and feel like, oh, what is this? This is awful. Therefore, you need to take care of this whenever you notice this. The food we eat in most of the time impact on the color of our teeth. Imagine people who chew goro, the smokers, and all these variants of food that we eat definitely do some kind of coloration to our teeth, for which, without having a dental care or dental attention, you may not be able to do it yourself, either by brushing or whatever self-care you do at home. So it is very important that every adult, even children also, because we have seen children also as early as 3, 4, who comes into the clinic and most of the time they have stain, they have calculus, they have plaque, and all these things that we need to take care of in the clinic. This is the basic preventive thing that every one of us need to do if we want to protect our teeth for life. It is possible because dental diseases are entirely preventable if we take the necessary step that we need to do in order to make it to be in healthy state throughout our life. So that is one fact, that dental diseases are preventable. Sometimes, well, some people will say, I still clean my teeth, I still do all this, I still do everything that I need to do, but I still have maybe decayed teeth, I still have hole on my teeth, this and that. Yes, it's possible. But once you incorporate the habit of dental checkup into your life, that is once in a while, 3 months, 6 months, or depending on your lifestyle, make it regular, how frequent your doctor or whoever you see recommend to you, then you will be able to keep a clean state as far as your oral health is concerned. Now, let's talk a little about what do we do to make our teeth and mouth clean at all time. Of course, number one, which we all know, is the self-care we do at home. Tooth brushing with toothpaste. We all know this, and this has been done from age immemorial. The toothbrush are in various formats. We have the manual, we have the mechanical or the electrical. Whichever one you choose. The important thing is that it has to be used with toothpaste that contain fluoride. And once you do it, at least minimum of 3 minutes and twice daily, and you brush it in a methodical way. There must be a way that you do it, which maybe we will see in another episode, the correct way to brush our teeth. Because many people don't know. Some people just think it's like your cooking pot that you have to wash with spongy spoon and then put a lot of pressure, a lot of force. No. You put too much force and pressure, you are going to damage the teeth. You are going to hurt the gum. So there is a methodical way that we have to use when we are brushing our teeth. So we'll see that one in subsequent episode. And of course, we have the demonstration model here, the brush, and then the demonstration model. And the way we use it, we are going to demonstrate at subsequent episode. Aside from toothbrush, the other thing we do to clean, to make our oral environment clean, is tongue cleaning with tongue cleaners. Tongue cleaners are special devices, and I have an example of a tongue cleaner here. We call it tongue scraper or tongue cleaner. We use it to clean the tongue, and it's better, much more effective than the brush. And of course, when you can't have this, if you use your brush, you can still be able to clean your tongue, but whichever way you do it, you go to the back side of the tongue, try to draw the tongue scraper, or whether it's your brush, from the back to the front, gently, in a gentle stroke. And as you do that, you have to make sure that it doesn't cause gangling. That is, you want to throw up or you want to vomit. You have to prevent that while you are cleaning your tongue. But as I said in the earlier episode, the tongue we must clean at all times because it harbors a lot of germs, it harbors a lot of bacteria, which most of the time cause whenever you look at your tongue and you see some yellowish discoloration or whitish slough on the surface of the tongue, definitely is not clean, and you have to do something about it. In addition to that, we have flushing, dental floss. Dental floss is a piece of thread or tape that we can easily manipulate in between the teeth in order to clean the interdental spaces or the space between the teeth. It is better because most of the time when we do our brushing, the brush fiber may not be able to penetrate these interdental spaces. Therefore, the dental floss does that better, and it's recommended that we should do our flushing at least once in 24 hours. Also, we have rinses, that is medicated mouthwash or rinses, which is very important. And this one kill bacteria, keep the mouth clean, and keep the breath okay. And because they kill bacteria in the process, we prevent dental diseases, gum diseases, keep fresh breath, clean mouth at all time. I'm sure you have been a little bit informed in this episode.